Hello, how are you? I'm Dr. Alexander Mota, and today I'm going to answer a question about chest pain that radiates to the back. I've been receiving so many questions, both in the comments of the most recent videos and from all the videos. There are more than 120, so there are a lot of questions, and unfortunately, I can't answer everyone. Today's question is from Lady Ann Alves. Hello, good morning. My husband has pain under his chest that radiates to his back on the right side. What could it be? Well, Lady Ann, here's the thing. There are countless things that can cause or contribute to this pain. All right? If it were on the left side, it would be a bit more concerning. Why? Because the heart is on the left side, and that retrosternal pain is typical, right? This chest pain radiating to the back, to the scapula, or even to the left arm could be a sign that the heart is sending you to pay attention and get an evaluation. All right? Since your husband's pain is on the right side, it leads us to think about the other side of the chest, the other side of the diaphragm, right? Which is related to the liver. I'm not saying that your husband's liver has any problem, but mobility dysfunctions, changes in the movement of the liver, usually cause these little pains in that region below the chest, and sometimes it radiates to the back, okay? Another thing it could be is a problem with the mobility of the ribs. There are ribs on both sides here, right? Imagine that each of my fingers is a rib. So they have to open to the front and to the side. The last ribs, okay, below the chest, they have to open to the front and to the side and in a symmetrical way. When there's a rib that isn't moving well, it interferes with the movement. And then get bone pain, pain from the rib itself, right? Muscle pain, or sometimes even a little nerve that gets compromised, gets compressed, which causes that annoying little pain, okay? It's important for your husband to get an evaluation with a good osteopath to see what might be causing or influencing, contributing to this pain. Most of the time, it's something simple, okay? But it does deserve to be evaluated. For now, what can you do? Or at least, what can you suggest? Share this video with your husband, okay? Or with anyone else who feels a similar pain. You can do the following. Place your hands here below your chest, like this, and breathe, observing the movement. You're not supposed to take a breath all at once or empty your lungs all at once. Try to take a longer breath. You will notice the movement of your ribs with your hands, okay? The ribs should rise, as I said, forward and to the side, symmetrically, meaning the same on both sides. If the right side isn't opening, in other words, if your husband breathes and only one side opens, it means those ribs need more movement. The ribs and the diaphragm as well, okay? What can be done to improve it? You lie on your left side with your right side up. You can even put your arm here over your head. And try to breathe into the right side here. I'll stand up, but imagine that I'm lying down. Here's my bed. I lay down. So look, you're lying here, the arm over here, and breathe in a way that you want to lift these lower ribs here. Look. And remember, these are long breaths, okay? I almost knocked over the camera. Poor phone. These are long breaths, so you're going to take a breath like this. In the beginning, it might be hard to move this area, but keep trying. It's not about strength, it's about technique. So start doing it. By the second or third time you try the exercise, you'll see that it will start to move. You can even use this hand instead of putting it over your head. Just rest it here on top of your ribs. That way you'll be able to feel the movement of your ribs better. Do this about 2 or 3 times a day. 3 or 4 minutes is more than enough to restore that same mobility to your ribs. And when your ribs are moving symmetrically, it means that not only are your ribs themselves moving, the diaphragm is working better. And the organs directly connected to the diaphragm, mainly the liver on the right side and the stomach on the left side, have good, satisfactory mobility. All right? I hope I was able to help your husband and anyone who feels this pain in the ribs or those pains in the back that radiate, okay? That follow along the rib line. But remember, it's important for you to get checked, okay? Because many times these pains may actually be pain referred from other problems. So I'll stop here. Big hug and see you next time. Bye!